All right, continuing the airway and breathing course. Continuing the ET tube unit. This one is on bougies and stylets. Why do we need something in the tube? Well, because that ET tube tip is soft, it's flexible, it won't go where you want it to go. The bougie or the stylet lets you direct it through the cords. It won't kink over, and bougies and stylets are good. You should use one or the other. Well, which one? Well, here's my deal with stylets. I think they're great. They're wonderful. I learned on stylets. Very comfortable with stylets, but you can't use a stylet if you've got a grade 3 or a grade 4. You've got to be able to actually see the cords. And all too often these days, it seems like we're seeing grade 3s and sometimes grade 4s. The bougie lets you manage the grade 3. You can use the bougie when you can only see the epiglottis, and then you can feel your way in by using the tip on that bougie. That's a soft tip that extends beyond the tube. The stylet is not to extend beyond the tube, but the bougie was meant to go in there feeling around. The coude tip lets you feel that bougie bouncing along the tracheal ring. So review anatomy briefly. The cartilage rings that support the trachea don't cover the posterior part. They cover the anterior and lateral, say 3/4, a little bit more maybe. They wrap around the trachea, leaving the back open. So that's why the tip is shaped like that, so that you can catch those rings as you're pushing your way along. That lets you feel the bump, 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 and now you know you're in the trachea. If you can't feel those rings, it doesn't make you bad. It makes you normal, and some folks have trouble with it in some patients. But once you put that bougie in the patient a fair amount, it should stop. It should hold up at the carina. And so that lets you get tactile feedback, lets you feel where you can't see. If you were in the esophagus, you could bury the whole thing, and it would never come to a holdup. Stylets, most of them are malleable, meaning you can shape them in whatever shape you want. There's a specific shape that is best. The glide scope has its own rigid stylet, but that's a different discussion. You do not let the stylet extend past the tip of the tube, and the tube should be straight to the cuff and then 30 degrees. For direct laryngoscopy, the only shape you ought to use is straight to the cuff and then 30 degrees. The bend is right before the cuff. The bend is not earlier in the tube, the bend is right before the cuff. Then you should always make sure that the shape of your tube matches the shape of your VL blade, and so you may want a curved or arcuate sort of stylet shape, and you just match that up. What King Vision we use in class has a channel blade. You don't even need a stylet or a bougie, because the tube itself, the blade itself has a place for the tube to go. But again, you'll see more of this stuff in lab.